When I'm taking a peptide, how should I be doing it? Should I be doing it in the area if I have joint pain, like my shoulder or my knee? Are you just be doing it in the belly? Do pills work? Let's break it down for you what you should and should not be doing. Here are the do's and don'ts. First, the don'ts, because that's the most important. That's what I see all the time of people doing things they should not be doing, and then they need help with us fixing it and hopefully limiting the damage that other people have caused. Somebody saw somebody on YouTube or Reddit telling them to do something that they shouldn't be already doing. So number one, do not inject on your own into your joint, into your shoulder, into your knee, into your thigh, just because you saw it somewhere. There's a lot of downside there, and I'm gonna kind of go through the couple of the reasons why you should not be doing it. Number one, you're not a doctor, you're not a healthcare professional, you should never be injecting into the joint. The risk of you hitting a nerve, hitting the wrong area, hitting an artery, putting medicine in the artery, which is a total no-go, it's just, the risks are too large. When you're doing peptides in your abdomen, you're going to usually get enough to get the relief that you're looking for. I've had patients, and it's not just one patient, it's double or triple digits amount of patients that if they've had a rotator cuff tear, a meniscal tear, or labral tears in their hip, knees are a little bit different, I'll get into that in a second, or plantar fasciitis, by just going in the abdomen, have gotten complete relief. I've had patients do PRs in 3 months after doing a peptide regime. So understand that. You don't need to be doing the joint at all to get the benefits you're looking for. Secondly, if we're gonna do a joint, a doctor can do your joint. A doctor can be doing it either under ultrasound or by eye, depending on where they're going, what their expertise is. I've done both. They work well in either way. And if we're injecting somebody's joint, we are not injecting somebody's joint every day. That's something you need to understand. If you're getting a cortisone shot, if you're getting a PRP shot into a joint, you're not doing it every day. That's the same reason you should not be injecting a shoulder or a hip every day. It's just too much medication in a small area. That's gonna cause more inflammation. That can cause toxicity in the nerve, the artery. We've seen even people have chronic inflammation where they can't put like a shirt on or a blanket on because the area is just so hypersensitive from all that medication applied locally. When we do an injection, we're doing an injection maybe once every 2 weeks, maybe once a month, and that's it. And then what we can do is we can supplement that injection in the joint with having you do it either orally or most cases doing it subcutaneously in the abdomen. What subcutaneously is taking that little insulin syringe and just putting it around the belly button, and you're going to usually get sufficient amount of treatment. Third part is if you're going into like a lot of areas, the hip, the deltoid, that's muscular. You're trying to give yourself an intramuscular shot of peptides. It's not gonna go where. That's what we have you do is subcutaneously. It's much closer. It's gonna spread diffusely much easier to get out of the muscle, and you're just gonna cause local inflammation and not achieve what you're looking for. That's something to be cognizant of. You don't want to cause more inflammation. You're guided by doing peptides for pain in most cases or to boost performance is to do it the right way to help decrease inflammation, increase recovery, not do the opposite. So again, I strongly don't recommend doing injections into that area. Another point is going to be when we do an injection to a joint, we're usually doing a larger dose than you're going to do in your abdomen daily. So by doing injection into the area, you're going to not potentially give enough medicine into that area, and you may not be injecting in the right area. So those are the main reasons why you don't need to inject the peptides into that area. You can do it, again, in the abdomen if the doctor feels confident with you and has evaluated the complaint. What I will do, especially mostly just for the shoulder, is if they want to once or twice a week, like giving yourself a flu shot, the skin, the muscle in the deltoid is not as thick, you can probably get away with doing it once or twice a week to not irritate the area. If you're talking about the hip is just so muscular and there's a lot of nerves. You got sciatic nerve, the sacral nerves. It's just not worth you injecting in there blindly. It's not gonna get where you wanna get to. Just don't even think about it. If we're talking about elbows, you got your ulnar nerve, you got your radial nerve, you could actually damage the nerve, cause inflammation in there, and you could have a permanent neuropathy. Don't do the elbow. The doctor can do the elbow very superficially, very easily, and you're fine. I mentioned knees are kind of an asterisk in the sense of not that people should be injecting their knees, because again, if you're trying to do it, a non-doctor can't inject the knee appropriately. You're going to hit the bone, you're going to cause more inflammation. Again, I've had patients hit the surface nerves of the knee and they cause themselves pain. And then again, I say, can I inject into my hamstring, or can I inject into my thigh or my calf? Again, it's muscle. It's not going to go anywhere. It's just going to cause more inflammation than probable benefit of it. It's going to get there. If the doctor feels that local is better, then let the doctor do it. Either the doctor, again, is going to be able to increase the dose and inject into the exact right area. We're also going to be able to use medicines that you may not be able to use. We can use, again, let's talk about knee specifically. We can use Pitocin. Pitocin's an old and new peptide at the same time. It's been around forever, been used for some bladder issues, and now we're learning how good it is for knee injections and knee arthritis. So we're now using that, again, where we inject it in either by itself or with hyaluronic acid, which is the fluid, not fluid, but the kind of gel that helps the knee and the joints move. And then you can do it help yourself by injecting yourself in the belly. You're not injecting yourself every day in the knee. We're not injecting your knee every day. We don't do that. Again, for that same reason, you can use Pitocin. We can use AOD, which is a growth hormone peptide derivative. Usually that is mixed with hyaluronic acid. We can do BPC. We can do thymosin beta-4 TB500. We can do both. We can even do the other growth hormone peptides like a CJC 1295 with ipamorelin into that joint. These can combine. We know how to combine it. We know what dose. We know to appropriately put it. So we can do your knee, and then again, you're going to back that up by doing that in the abdomen. The goal sometimes is also to make sure we're getting increased medicine to get it in the joint, especially dealing with an acute injury, acute pain. Then we can look into doing IV peptides. And that is us giving you a larger dose, we call a bolus, is going to get the process started by, again, giving you a much larger dose than your body is going to tolerate through injections. It's going to spread through your whole body because it's being given intravenously. That's how you're going to get to the joint area. Do not inject yourself anywhere with the abdomen unless the doctor has given you specific instructions to do it in a way that makes sense. If they're telling you to inject it intramuscularly, not going to give you much benefit, and that's not appropriate information. If a doctor is telling you to inject that area every day, don't do it. It's gonna more likely cause more problems than benefit. Not only myself, but other doctors have seen the benefit by doing it, again, by doing a local shot and then you doing it not in that area, just doing it in the abdomen. If we need to switch to orals, which not always is effective, that's fine. The BPC works pretty well orally. The TBs, TB500 or thymosin beta-4, not as great orally. CJC, not as great orally, but some patients really get a benefit from it. Pitocin is not effective orally, not available orally. And there's not a lot of what we're using now are bioregulators with it. If we're talking about something for joint, we're doing either Cardilax or one of the other bioregulators can help. And then we add in things like spermidine or Mitopure, which is urolithin A, in addition to help with the inflammation. Well, for the last time, no matter what it says on Reddit or other things on YouTube, I've done hundreds of cases, do not inject the local area on a regular basis. There's a more than likely that you're going to get negative than positive effect of it, and doing the belly stuff works. Listen to me. So if any questions, put them in the comments. If you like what we're talking about here, please subscribe to the YouTube channel and stay tuned for more information.